This morning, Senate Democratic leader Chuck Schumer said both sides agreed to the framework of the new virus spending bill, which would hopefully be passed soon. Here to react is Seth Jensen, healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis. Seth, hospitals, they make money off of surgical operations like cardiac stent procedures, colonoscopies, and MRIs. Of course, COVID-19 has put all elective surgeries on pause, leading some healthcare executives to cut payroll and furlough employees. How do hospitals recover from this?
Well, this is a big challenge, right? And a lot of times we as Americans, when we hear elective procedure, we think cosmetic, but that's not the case. The CDC has pretty much set a guideline that elective procedure is pretty much anything that won't save your life. And so, for that reason, hospital systems by and large throughout the country, specifically in areas that aren't hard hit with coronavirus, like, Midwest Nebraska, for example, these hospitals are really challenged, as is the entire healthcare system, because they can't see their normal patients. Healthcare is a business, and it's a sixth of our U.S. economy and something that we absolutely need to address in this crisis.
What about for those employees, those hospital workers who have been furloughed right now? Are they going to be welcomed back with open arms as soon as this bill passes?
Well, I think that that's a big part of it, right? I mean, hospitals need people. They're run by people. They're managed by people. And the same is for every downstream healthcare office. My personal doctor, for example, just yesterday had to furlough all of his employees because he just can't keep his doors open. And unfortunately, the PPP money that was originally set aside went away. It was utilized, and there isn't more of it. So this is a necessary bill to get passed to support not only small business, but specifically our healthcare system.
Seth, we're seeing in certain states, I want to mention Georgia specifically, planning to reopen these businesses such as barbers, hairstylists, tattoo parlors even on Friday. As soon as this Friday, these specific industries, it seems as though you're totally disregarding social distancing regulations. Of course, you can't be 6 feet apart when you're trying to do these tasks. What does this say about the ongoing health crisis and, of course, the economic crisis as well, the fact that these businesses still need to reopen to pay their employees?
Sure, and I think this is part of the question that many Americans have and a topic that needs to be addressed, right? The entirety of the United States is not New York City. It's not Detroit. It's not Chicago. There are parts of our country that have very little, if any, active COVID patients. And for that reason, we need to have a reasonable conversation about when it makes sense to reopen the economy and at what level. That being said, reopening the economy in places like salons and tattoo parlors and others, understand that it can't go back to the way that it was before. We need those people to be wearing masks. We need to do temperature checks. We need to make sure we're taking proper sanitary steps to ensure that those areas are protected and that isn't a new area where the virus can spread.
Right. We need those healthcare workers back to work, and we need everyone else back to work as well, safely, of course. That's Seth
right.
Jensen, healthcare analyst. Seth, thanks so much.